Today, my guest is Kristen Waite-Labatt. Chris has a story to share, and it gives us a look at the other side, the perspective of a licensed nurse who developed a substance abuse problem. She's willing to share her story, as painful as it is, so that others can benefit from it. Thank you, Chris, for your willingness to open up.
Thank you, Terri, for
Please.
inviting me.
Sure. Please tell us a little bit about your background, what you think set you on the path toward substance abuse, and how it escalated to the point of drug diversion from your workplace.
Sure. So I've been a nurse for 30 years this year, which is really, really hard for me to believe. But and when I first graduated from nursing school, I went to work on a pediatric unit and had no idea that that's what I wanted to do, but really fell in love with it. And all through college, I had pretty much used alcohol to help me cope with anxiety, some depression, some mild depression too, but mostly at that time, anxiety. I found that I drank a lot more than my peers. I binge drank often, and it so much so that it took me about 6 years to get my 4-year college degree. I did end up having my first daughter there as well, which I think really at least helped me for a while, kind of clean up my act, and I was able to graduate. And after that, not too much. It was pretty much work, take care of my daughter. But if you fast forward now, so that was in 1991 that I graduated from school, college. Fast forward to 1997, and I had a minor surgical procedure and was prescribed Percocet. And I found that I really liked the Percocet. What I liked most about it is that I didn't act goofy when I took it. So like alcohol, of course, you smell bad, you stumble around, obviously if you drink enough of it. And that was certainly my experience with alcohol. But with Percocet, I didn't have that. I could get the same, it made me feel better, for my anxiety. It helped that in the same way alcohol did, but I didn't have all those other effects. So it was easier to hide it. And I don't know, it felt better taking it, which is a strange thing to say, but I felt better, and it seemed a more reasonable thing to do or to take. So the years following that, whenever I could, I would get pills. So if I had back pain, I would go to my doctor, exaggerate my symptoms. Most nurses have back pain. I would exaggerate my symptoms, and she would prescribe me something. Usually it was Vicodin. I got married in 99, and my husband, while we were dating, and then after we were married too, would get pills periodically. He's a carpenter, would hurt himself. And the ER would be, very quick to give him whatever he asked for. Usually it was Percocet, oxycodone. So he would share his pills with me. I would sneak his pills. I remember one time calling in a prescription for him for a refill that he didn't even know I was getting. And so took all of those. So that was kind of my MO, I guess, for the next couple of years. Sometime around the year 2000, I was working in an emergency room, and it occurred to me that we threw away a lot of drugs. And I just, for whatever reason, without enough thought or without much thought, put what I had left over from a patient in my pocket. And I took it home. It was an IV med, and I took it. And I remember, similar to when I first took that Percocet after my surgical procedure, I remembered just realizing how much better that was in the feeling it gave me and the relief it gave me. Because number one, it was immediate because it was IV. So it was it was immediate. And it didn't last as long. So that's another thing I liked about the IV, is that I could take it, and I knew if I had to go somewhere in an hour, I wouldn't, it would have worn off enough that I could at least appear somewhat normal. So I continued with that, taking waste whenever I could. Didn't go beyond that at that point. I really had myself convinced it wasn't any big deal because it was garbage, right? I was just taking garbage. It's not a big deal. Of course, it is a big deal, but I had myself convinced that it wasn't a big deal. So then maybe around the year 2002 or 2003, I, for the first time, had leftover fentanyl. I remember distinctly, and I was also going through a divorce at this time. So my husband also used plenty of substances, as I kind of alluded to, but wasn't a great marriage. And so we separated, and it was actually a really good thing. It was not a good marriage, but we had another daughter. So I had two daughters at that point. And he left, and I just felt completely overwhelmed. I felt very afraid of what my future was going to be. How was I going to raise two kids on my own, two girls? And so it was about that time that I first experienced fentanyl. I remember specifically that first time I took it, I felt, first of all, it was very powerful. It was strong, way stronger than the other, whatever else I had used before that. And I just had an intense craving for more. I know that, I'm sure anyway, it had something to do with the fact that it was so powerful, and my feelings were I was so depressed and anxious at that point that it calmed that. But it's also so addictive. I just immediately craved more. I hadn't had that feeling before. I always wanted more, but this was a different experience. The craving was so strong. So it was at that point that I really started seeking it out. Before, if I got waste, I would take it. If I didn't, I wasn't happy necessarily about it, but I wouldn't necessarily take anything. After using that fentanyl for the first time, I began stealing it from stock if I didn't get any waste. And eventually, until I was caught, I started taking something every time I was at work. I know that so I mentioned how I felt, how bad I felt, but I didn't really mention how bad I felt. I mentioned being able to kind of talk myself out of the fact that it was a big deal, like saying to myself, not a big deal. So when I transitioned to actually stealing it, obviously I couldn't say that anymore to myself. So what I'm getting at is, how did I justify in my own brain, like stealing from stock, and eventually using it while I'm taking care of patients, which is what happened. And I guess I would answer that by saying, every time I took something, it was always going to be my last time. So on my way to work, I would be talking to myself and praying and saying, I'm not going to take anything tonight. I'm done with that. I don't need it anymore. I won't do that. I'm not doing that anymore. But the minute I would walk into work, those thoughts would return, that I needed something. And particularly in the last maybe 6 to 9 months before I got caught, the minute I would walk into the hospital, walk through those doors, I would just be compelled to go and get something. I just could not take it. That was so strong, that pull to do it. So once I started stealing it, it sure didn't take them long to figure out that it was me. We had a small department. There were about 18 of us nurses at that point. I was on a transport team. And I do think it was 6 to 9 months before they actually figured out it was me stealing it. But once they did figure that out, I arrived at work. It was a Sunday night at 8:30. I worked night shift. And I was confronted by my manager, who was, of course, never there on a Sunday at 8:30. And she took me into a room. There was a sheriff's detective there, a deputy, then our head of HR, our head of security, our head of pharmacy, my manager, the chief nursing officer, just room full of people that I was absolutely stunned, shocked. I think I entered into like this shocked, phase. So I sat down and they confronted me, and I don't remember much, honestly, about that meeting, other than I denied everything.
Hmm.
And they let me go home. They suspended me, but let me go home. Eventually, though, I was fired from my job, lost my nursing license, and I ended up spending about 4 months in jail. I had I had a relapse, I guess you could call it. I was clean and sober after that for a little while, but started working in a doctor's office as a medical assistant and started calling in prescriptions for myself very soon after getting that job. So getting caught after that as well, I ended up with a felony and 4 months in jail, and then some probation after that. But all of that to just, I mean, I'm trying to tell the story very succinctly because I know we don't have a whole lot of time. But I guess what I'd really like to talk about is that intervention time, or that time when I was confronted, just the way that happened. And then my manager during that intervention, I call it an intervention. I'm not sure that's exactly the right word for it, but she started to say to me, Chris, if you would just tell us you need help, we can help you. And she was actually shushed by someone else. I don't remember now who shushed her, but she was not allowed to offer me any help or, comfort me or anything like that. Really the only purpose behind that was to get me to admit what happened so that I could be prosecuted. The intention was not to ever keep me there or, offer me treatment or anything like that. It was, I was fired. Either way, it was going to happen. So this was in 2004, and I think things have changed considerably since then. But that still happens often, that the nurse is fired and loses pretty much everything, because once you're fired from your job, you lose your insurance and your ability to get treatment.
Right.
So,
do you think you would have, if they had handled it differently and she had been allowed to continue on that path to urge you to just please let us help you, do you think you would have admitted?
That is a really good question, and one I have thought about often over the years.
Yeah.
I was seeing a therapist for about a year before I got caught. I had come clean to her and told her everything I was doing. I had seen her previously for depression and anxiety. And when I first disclosed to her, she said that I needed to go to inpatient treatment. And I said, I can't. I have 2 daughters I have to support. I have a job. I can't go to inpatient. And I really refused to go. And she said, well, we'll try this, one-on-one. I refused to go to IOP, intensive outpatient, because I know in my mind, I didn't want that level of care. Like wasn't ready to deal with all of, but I was also telling myself, if you just figure out what's wrong with you, then you'll be able to stop using. Like you won't have to use those if you can just figure out what's wrong.
Right.
But of course you have to stop using first, or you can't manage any of them.
Right. Yeah.
So she made me, sign a document saying I would stay clean and I would meet with her twice a week. And if I used again, I would go inpatient. And although I continued using, I just didn't tell her because, again, I thought I just needed to figure out what was wrong with me. And if I told her, then that meant I had to go inpatient, and I couldn't fathom that. So I also wonder if she had known, because I've spoken to her since, and she had no idea there was a program that I could join confidentially through the nursing board and keep my license and be monitored and get treatment. If I had joined that before getting caught at work and having, the whole everything happen at work, that I could have stayed anonymous and gotten help. But she didn't know about the program, and I didn't know about that program. And I don't know if that's maybe what my manager was going to offer me there at that intervention. So that's a long way to answer the question. I'm not sure if I would have been able to do that. Number one, submit myself to that monitoring program confidentially, or number two, accept help had I been offered it at the intervention. but maybe I would have. I don't know, but maybe. And I think there are so many nurses that are going through the same thing I am. 10 to 15% is the, accepted number. Maybe some of them would hear that message and report themselves or get the help that they need. Probably not all of them, but I'm certain that a portion of them would.
Right,
So I think
right.
that's
Yeah,
important that
it's
we know.
yeah, it's pretty tragic that the counselor didn't know that. You would
Yeah.
think that that would be something that they would know, or at least once they acquire a patient that is in that circumstance, would do the research to find out what their options are. It sounds like too, though, you were still concerned about how you were going to take care of your daughters. So you might not have, even if you knew, because there was still that support that was missing for you to, leave them alone during that time.
Right.
But yeah, certainly we need to know that information so we can pass that on to people so they can make a little bit more of an informed decision without just being scared of
Right.
everything. Did the hospital that you work at, so you didn't admit, they let you go, they ended up terming you. Did they ever call you back for another interview, or did they tell you what evidence they had, or did they just go with, we know she's basically, essentially, we know she's lying. Either we could tell or the data tells us she's not. And so you're just done. Is that kind of the way it happened with them?
Yes, my manager called me a couple days later and officially terminated me. And I met with so I also decided that I had to turn myself in and kind of confess everything. I felt so bad. And so with a lawyer by my side, I went back to the detective and confessed to everything and wrote
Okay.
out a statement. So when I was speaking with him, he did go over the evidence of what they had. And basically it was kind of ruling out who the person was. And for the last couple of weeks, it was down to me and another nurse because she and I worked together all the time, almost every shift. So once she was gone, or she was on vacation, I think it was, and I was on, that's how they figured out that it was me. So then they went back, and every time that a fentanyl was missing, I was working. And so that's kind of the evidence they used. I also altered the record for the count, like the drug count, so they could show that. Trying to think what other stuff they had. I don't remember now, but he reviewed everything with me.
Yeah. Yeah. Was it all on paper? Was the inventory on paper in a cabinet, or was it in an
On
automated
paper.
dispense? Paper. Okay.
Yeah.
Yeah.
Because I was a transport nurse, we had portable pack. And so
right. That's right. Okay.
Yeah.
Yeah. So a little bit different.
Yeah.
You had mentioned, when I heard you spoke a while ago, you had said that you maintained your performance. Were there things that your coworkers should have seen and they just ignored, or maybe weren't educated enough to know what they were seeing?
Most definitely. I do think it goes to the education, that they just didn't know that what they were seeing was drug addiction. Some things like increased breaks. I took, especially toward the end, I was taking a lot of breaks. Now I smoked cigarettes, so that was at the time. And so that was always my excuse. I'm going to go, it's slow right now, I'm going to go have a cigarette. Oh, it's slow again, I'm just going to go out and have another cigarette. Of course, those breaks got closer and closer together as my disease progressed, to the point where I was probably going out once an hour. I wasn't going out for a cigarette break. I was going to the bathroom to use. But then I would come back and I worked night shift. So there were, yes, I kind of would nod off a little bit, but everyone would say it's because
Night shift.
you're tired because you work night shift. We were also allowed to sleep between our calls. So I could use and then come back and just lay down. And obviously then nobody would notice. I always volunteered to do the count. So we had to do all checks of not just the drugs, but equipment too. So I would always volunteer to do that. And then I would do the count, and then I would take the book upstairs and say, oh, here, I did the drug count too. Can you just sign off on it? And that's usually when I would take the fentanyl. So drawing in my peers who trusted me as well.
What was the process that it should have been counted with a witness, or was it pretty,
Yeah.
it was, but they just
Yeah,
trusted you? Why they didn't want to take their time? Okay. Okay.
exactly. And heavy wastage of drugs. I would always pull up drugs before our transports just in case I needed them, even though I had no order for it and there was no indication that
Mhm.
I would need it. And then when I'd
Right.
come back, I'd say, oh, I drew up this fentanyl to use for a patient, but we didn't end up using it. Can you sign off on my waste? Nobody ever
Mhm.
saw me waste it, but would sign off on it as well. So again,
Right.
using my peers and them trusting me because we had worked together for a long time.
Sure.
And shaking too is another, at least for me, was a really strong indicator. I got really shaky towards the end. And again, night shift, people saw me shaking. I remember a respiratory therapist, like I was shaking so much I had to put a medication in an IV and I had to steady my hands on the bed in order to do that. And the respiratory therapist I was working with saw that and looked me in the eye. And I thought for sure he was going to say something, but he didn't. I imagine he wrote that off as, we drink a lot of caffeine on night shift to stay awake. And
Hmm.
I can imagine that he would have used that as an excuse. I was very irritable, which is unusual for me. I'm relatively friendly and outgoing, and I got very withdrawn and irritable. People attributed that to my divorce because I was going
Sure.
through that separation. There were reasons. I mean, I think they noticed the behaviors, but wrote them off, gave them an explanation and wrote them off. But looking back and
Yeah.
the combination of all those things
Yeah.
is something I
Yeah.
think that
They should
now
have
hopefully
seen.
they would recognize.
Right. And not only were you exhibiting those things, but I'm guessing that was a change, right? If they
Right.
really had put it all together, she didn't used to take these frequent breaks. She didn't used to ask for witness on her waist all of this time. There wasn't shaking before. So not only recognizing some of the signs, but then recognizing that their peer is behaving differently than she did 6 months ago, 8 months ago, a year ago.
Exactly. And attributing
Yeah.
that to the difficulties I was going through too.
Yeah. Did anybody pull you aside and ask you, are you okay? Is there anything besides your divorce going on? Or is there anything?
No,
No.
nothing. They were all
Okay.
very shocked it was me or that happened because they did it from
Okay.
my
It looks like we've got a little bit of a connection problem here. So maybe Chris will come back, but I want to thank you, Chris, for sharing this with us. And I want to encourage all of the listeners to join us next week for another interview with Chris. We are going to discuss how she has turned her struggles into a desire to help others. And we're going to find out exactly how she's doing that and everything that she's involved with. So I want to thank you, Chris, and look forward to our next interview with you. And you're back, by the way, I can tell.
Great. Good.
All right.
Thank you so much,
Well,
Terri.
we will talk soon.